Hi, everyone. Welcome to another episode of Bench to Bold. I'm Marnie.
And I'm Elisa.
And we have a great guest today, Erin Stuckey, who's an attorney at McGowan, Hood, Felder, and Phillips. And she has so many great, important messages for us. So I'm so excited to have Erin on. So Erin, obviously, we love what you do because you're out there giving advice and being advocates for families that are in need of guidance when they have a situation revolving around a loved one who has been in a nursing home or rehabilitation center and places that they might not feel comfortable or ever expected that their family members were going to be spending time in. So can you help us navigate some of the things that may or may not happen when a family is in family members in a nursing home or a rehab center?
Sure. Thanks so much for having me on. I'm an attorney here in South Carolina, and I've got kind of a unique perspective on this. For much of my career, I defended hospitals, nursing homes, rehabilitation centers, nurses, therapists when they got sued in medical malpractice cases. But I've since about 3 years ago switched over, and now I represent patients and their families, specifically when the system fails them and there's some kind of negligence that occurs either in their care or in the care of a loved one. And so seeing both sides really gives me that perspective on how care breaks down, and really most importantly, how families can protect their loved ones before that breakdown ever occurs. And so, some of the things that I think we should talk about and that are important for people to know is, number one, how to make an informed choice. When you are deciding, if your family has been in an acute care hospital, has been hospitalized for whatever reason, maybe they're elderly and broke their hip and need to go to rehab, or something catastrophic has happened and they can't return home, they need to go to either a skilled nursing facility or an inpatient rehabilitation facility. You've got a choice on where they go. And a lot of families don't realize that. They don't recognize, that there's a choice until they're handed a sheet of paper by a case manager listing 4 or 5 different facilities and are told, hey, pick one. And it's a big choice, and you don't know, okay, how am I supposed to make that choice? What should I be thinking about? What questions should I be asking? So, doing that research up front and trying to figure out the best placement for your family member is really important. And it's a thing that I think people don't think about in advance and often make a snap or rush decision and often regret it later when something does go wrong.
Yeah. So, I recently have spent, thankfully, the past 7 years, my mother, who passed away in March, she was living with dementia. She lived in the home with us, and we had in-home caregivers, which was such a blessing. And I'm very grateful for that. But it seems like when I did do some research and went and spent some time at inpatient clinics and places, that if it wasn't the right option for my mom to be with us, why is it that it's so hard to find a good place for family members? What is that? Is that just, how come it is so difficult to find a place where you would feel comfortable leaving a loved one?
I mean, I think the reality of it is that no one is going to provide as good of care for our family members as we would. It's just something that, when you can provide one-on-one care to your family member, or have, like you mentioned for your mom, those caregivers who are in home and they're providing all of the care that she needs around the clock, one-on-one attention in a facility, no matter how great the facility is, they're not going to get that same level of care. It comes down to staffing in a lot of situations. Lots of these facilities are run by large national chains, who their staffing models are sometimes a little bit, fewer nurses, whether those are licensed registered nurses or CNAs or other kinds of technicians. Those ratios are often not what you would expect. And then you run into situations where your family member is in bed, can't take care of themselves, can't get up on their own, and they're calling for help. But you've got a tech who's trying to care for, maybe a dozen patients. And unfortunately, they're just not the highest priority at that time. That is certainly something we would never hope our family member would be in that situation, but unfortunately it does occur. And so that's where it comes to, doing your homework up front and trying to find the best facility, because there are really good facilities out there. I don't want anything to be, take away from the fact that, there are good facilities, and you can find facilities that have very few problems, get sued very infrequently. But unfortunately, there are some bad apples, and there are facilities that are constantly getting, complaints made against them, that are being fined by the state and federal regulatory agencies, who the family members are hiring attorneys to file lawsuits regarding the care of a family member. And so doing that research up front, looking at things like staffing levels, I think a lot of people don't realize that for facilities that are Medicare certified, there is a Medicare Care Compare website that just has an absolute wealth of information. You can just go to medicare.gov/care-compare. And the first thing that people see is it provides the star ratings for every Medicare certified facility. A lot of people, even if they don't know a whole bunch, can know, okay, is this a 5-star facility? Is this a 1-star facility? Somewhere in between. So it does provide that kind of data, but you can drill down much, much, much further into things beyond the star facility. You can look at health inspection reports. You can look specifically at staffing levels, and they will give you the information on, okay, how many licensed registered nurses are there for every resident of the facility? How many licensed practical nurses or LPNs are there? How many CNAs or techs are there? And so generally speaking, of course, for every generality, there is an exception, but generally speaking, higher staffing, more staff per resident leads to better outcomes. So, looking at that kind of data can really help you out, and will tell you up front, what the staffing levels are at different facilities. And you can use that website to actually compare different facilities. If you've been given a list of 4 different facilities that have an open bed, you can go onto that website, you can put in your zip code, and then it will pull those up, and then you can click the 4 and say, okay, we've got, a 17-to-1 patient ratio here compared to a 6-to-1 here. That gives you some helpful information when you're making these important decisions.
Thank you for all that information. I mean, because it is such a difficult discussion to have. Now, what happens if do people have discussions about what to do with family prior to it becoming like an urgent situation? I mean, how would you advise somebody as who was having elderly parents? What would you tell them to do before it becomes a situation where they have to make a last minute decision?
Yeah, that's the perfect question. Whether your family member is at home and is getting to a point where they need more care than you can provide in home, or for some reason they've had an acute care hospitalization and are not going to be able to be discharged back home, I tell people, the time to start thinking about this is when you first become aware of it. When the case manager or the nurse, if your family member is hospitalized, says, it doesn't look like we'll be able to discharge home. They have these discharge planning discussions with family members well in advance of the actual discharge day. You really shouldn't be thinking about this on discharge day. You should have been thinking about this as soon as it is raised as a possibility that your loved one can't go back to the living situation that they were in immediately prior to the hospitalization. Likewise, if you're thinking, mom's having some memory problems, we might need to get her into a memory care unit, you can start doing the research. So on that Medicare Care Compare website, you can look at all kinds of things and really do your research there. And I kind of see that as a way to narrow down the options, get a lot of data, look at staffing, look at other things. Falls and preventable pressure ulcers are 2 of the biggest problems that happen to people in skilled nursing facilities and rehab facilities. someone elderly suffering a fall ends up with a broken hip, things generally don't go too well for them after that, or getting these preventable pressure ulcers, on their backside because they're not being turned and repositioned as they should. Those are two metrics that Medicare actually tracks. They collect data on them. So on that same website, you can look at, what are their rates of falls? What are their rates of pressure injuries? What are their rates of hospital readmissions? And that can be anything like, they're not getting them out of bed and, things are going downhill. They suffer from an infection for some reason. They are given the wrong medication, which results in adverse effects and leads to a hospital readmission. So doing that research early, using the websites to narrow it down, but really, once you do that, you really do need to go visit the facilities. And nothing beats being there, seeing it with your own two eyes.
So, Erin, you made some great points about things that they could do online. But I used to be the case manager on the unit. And what I would tell my family members is there's no better way than to actually step into the environment, actually
Absolutely.
do tours. I would tell them and sometimes you're just not able to do that because it's one of those things where utilization review is saying your mother has to leave. And you were saying you need to really start to do things on the front end, because when utilization review decides it's time for the patient to be discharged, whether it be today or tomorrow morning, that's got to happen.
Right.
And, so if you do your due diligence on the front end, then you're not faced with, okay, my mom's leaving on an ambulance at 5:00 today. And you may have not been able to go tour that facility. But if you, are proactive and you actually go tour, because I think when you step into a facility, you actually, when you're in that environment, whether you walk in the front door and you're hit with a urine smell or, whatever you see, whether it be good or bad, you don't know until you're really in the environment. And then when you're there, I used to tell patients, I worked on the orthopedic unit, and I used to tell my family members, it's really important to talk to the different disciplines who's going to be involved in the care of your mom or dad or loved one, because, whether they're going to be there short term or long term, you want to know what they're going to do for your family member, whether they're there for, a broken hip and getting rehab, you want to speak to the therapist. If they're there for a failure to thrive, you want to speak to the dietitian. So there's no really true way to know what if you can't do a tour. By just being online.
Yeah, I completely 100% agree with that, Elisa. Just being in the facility, when you walk into an environment, you don't get a good feeling about it. You should trust your gut.
Right.
Your gut usually is not going to lead you wrong. Things that you look for, when I was on the defense side of things, represented, a skilled nursing facility where people lived there. This was not short-term rehab. They were there for, the long haul. And, they had an administrator, and every time I would go there and he was, taking me somewhere, we're going to go talk to someone, he's stopping every resident in the hallway, addressing them by name, asking how they're doing, asking about the grandkids. I mean, it was very obvious that he had a one-on-one relationship with each and every one of these residents. And that, when you've got an administrator of a nursing home who's taking that much pride and that much care in their residents, it says something about the facility. And if it was me, doing a tour, not, with my professional hat on, but, my personal hat, if I was touring for, a family member or a loved one, that would speak volumes that there is someone there who's in charge, who knows these residents, knows what they're there for, knows what their needs are, knows who their family members are. So things like that cannot be recorded on a sheet of paper. There is no metric that CMS, Medicare, or the state regulatory agencies can, come up with that's going to give you that feel. That's got to be an in-person thing. But when you're there are other questions that you can be asking. The excellent point of if you're there for rehab, you're going to be wanting to talk to the therapist. How many hours a day of therapy is my loved one going to be going through? Is it physical therapy, occupational therapy, both? Other things like, inpatient rehabilitation facilities that receive Medicare and Medicaid funding have a certain number of hours of therapy that must be performed per day to get the reimbursement rate. And so, you got to think about, is that something that they can handle, or are we just setting them up for failure if they can't handle 3 hours of intense rehabilitation a day? Go take a look at the therapy space. Is this somewhere where, you get a good feel about, is there good one-on-one or two-on-one patient interaction between the therapist and the patient? Because, when you've got people up walking, on parallel bars, doing exercises, and by parallel bars, obviously not the Olympics kind, but, learning how to walk again, they're going to need a lot of therapist support and licensed therapy assistant support, so they're not falling and further injuring themselves or injuring themselves worse. So those are things you want to look at. You can also ask questions about staffing. I think those are some of the most important questions you can ask about what's your nurse to patient ratio on the day shift, on the evening shift, and on the night shift, because it's going to be different. And you want to know how many people are there caring for your family members. You can ask, if it's a skilled nursing facility, how often a licensed physician or a nurse practitioner is there visiting residents. A lot of people don't realize that there's not in a lot of skilled nursing facilities, I'd say the majority, there's not a licensed doctor there at all times. They contract out with different agencies who send their doctors and their nurse practitioners in to visit patients on a routine basis and also on an as-needed basis. But really finding out about the availability of that specialty care is extremely important. If you don't live locally and your family member is going to need to be transported to outside doctor's appointments, whether that's, for, their primary care physician or for, some kind of specialized care. For example, if going back to the broken hip example, if they have orthopedic follow-up appointments with their orthopedic surgeon, how are they getting there? Who's arranging that transport, particularly if you're not there and can't assist? One last one, how often are care plan meetings held? In skilled nursing facilities, there is a requirement that they have care planning meetings where that particular resident's, plan what's going on with the resident, what their goals are, what's being done to achieve those goals. All of those things are discussed, and I really encourage families to participate in them, particularly if you've got a family member with some memory or cognitive issues who might not be able to understand and ask the appropriate questions, because one of the most important roles that you have as a family member is being that resident or patient's advocate. Nothing can, replace that. And so being as involved as you can really does help things.
One of the other things, Erin, people don't think about a lot. And the only reason I'm bringing this up and thinking about it is because I worked at a long-term acute care facility. I worked at Kindred Healthcare in three separate roles. And a lot of times people don't, and this is huge for geriatric patients that are in nursing homes or in a short-term acute care that may have been on a vent and been bedridden for a long time, is wound care. And
Absolutely.
There are not a lot of nursing homes, I don't know if people know this or not, that have an actual wound care nurse on staff. And that's huge because wound care causes a lot of issues. It causes a lot of hospital readmissions, and you need to ask what their readmission rate is to hospitals and why. But when wound care is an issue with your loved one, you need to ask these questions about wound care nurse and who's doing the wound care in these facilities, because you can get in big trouble with wounds.
Absolutely, you can. I always encourage people to, ask about policies that they have to try to prevent wounds on the front end.
Right.
They should be telling you things. When you ask detailed questions and you're met with, pushback or, a failure to answer the question, or if you get vague or defensive answers, that should be a warning sign. A good facility is going to answer these types of questions openly and going to welcome you in asking them, because you're going to want to ask things like, how often are you getting patients out of bed? what kind of skin breakdown prevention measures do you have in place? Is that for all patients or just patients who score a certain level on the Braden scale? Because, some patients can go in and have absolutely no risk of skin breakdown, but then things change and then they end up developing these wounds. And I mean, it's just heartbreaking when you see pictures of these wounds that develop, and they can develop quickly and get out of hand in an unbelievably short period of time and get down to the bone, develop osteomyelitis, which is a bone infection. And, they can kill people, and they do kill people. And, you've got someone in there for a completely different reason. And then all of a sudden, all of the care has to turn and be focused on, trying to heal up these wounds. And they have to be extraordinarily painful. I know they are extraordinarily painful, and lots of procedures that have to be done, surgeries that have to be done. So those are all questions that you should absolutely be asking, when you're choosing the facility.
Yeah. And, wounds, like you said, they may not have a wound when they admit, but if they're, one of the reasons to ask about nurse to patient ratio is because what happens if your patient's bedridden and they're laying in a diaper that's urinated feces or whatever they're laying in that will cause a wound. Those kind of things. So those are all great questions to ask for a lot of reasons. Or a diabetic patient, right?
Right.
That doesn't heal very well or very fast if you're a diabetic. So lots of good questions to ask. And people don't think about it. And, people don't think about this one. If a patient's there, maybe may have sundowner syndrome, and it's super important to ask, talk to me about the activities that you do while my loved one is here at this facility. What kind of crafts are you doing? What kind of, maybe they're taking them on field trips, or maybe they're baking cookies with them. These are all great questions, and people just seem to, not feel like they can ask about them.
Right. You absolutely are empowered and should be asking the questions, the easy questions and the hard questions up front, because once you get your loved one placed in one of these facilities, it's difficult to get them moved. And the last thing that you want to have happen is they have a hospital readmission where they have to go back to an acute care hospital setting because of something that's happened at the facility. So, doing the due diligence, doing the homework up front, the old saying, a little bit of prevention, prevents harm later. I am completely messing that up.
It's a Ben Franklin. I think it's a penny saved or a pound of prevention or whatever, something like that. But
it just completely makes all the difference in the world. And, I talk to families every day who are just heartbroken that they didn't do these things up front and didn't ask the right questions. And now, their loved one has suffered injury, harm, sometimes even death as a result of these things. And, you just never want to be in that situation where, looking back, you wish you had asked the questions, wish you had done the homework, you just trusted the system, blindly chose somewhere off the list, and then it just not being an appropriate placement for your loved one.
Yeah, I think it goes along. There are no stupid questions, just stupid answers. But it's hard. I mean, it's sometimes it's very difficult when you are being an advocate for your loved one. You don't want to appear, dismissive of other people or seem like you're questioning what they're doing. So it's a very delicate balance of being able to ask informed questions and getting good answers, but also feeling like you're not going to insult the nurses or the doctors and the team there, because they are taking care of your loved ones. So you're like, wait a minute, I don't want to make them mad. I mean, if I ask this question, well, are you doing everything you can be doing? Then maybe they are, but, we just have to, I guess, hope that the professionals are used to getting those kinds of questions, because it is not just a random person; it's somebody's loved one. So I guess that it's good to ask as many hard questions as you can, and not feel that whatever you're going to ask is going to be inappropriate.
Right. Absolutely. And then, moving to once they are admitted, you've done the work, you've selected to the best of your ability a facility that you think is going to care for them. Your advocacy role doesn't end there. It actually is just beginning, because the number one thing you can do is just be visible, be there in the facility, visit at varying times, sometimes go in the morning, sometimes go in the evening, go on the weekends, like it or not, staff members are more attentive to your loved one when family members are present and engaged.
Oh,
There's
absolutely.
just no two ways about it.
Yeah.
And so, being there, being respectful, but assertive, those two things are not mutually exclusive. You're there, you're part of the care team. You can fill them in on, this is what their baseline is. Normally, grandmother is not confused. She actually is really mentally sharp, but today, she's having problems, finding her words, answering simple questions. Something's going on. Can you alert the doctor? Being there, your loved one best. No matter how long they're in a facility, you as the family member are always going to know them best. And so raising red flags to sometimes things that are subtle that people might not pick up on. They might think, oh, your grandmother just has a touch of dementia or is a little forgetful today. And you can say, no, absolutely not. She's actually, very sharp. I'm wondering if something's going on, because, that kind of altered mental status can be a sign that there is a problem, and, you can alert them to that. Learning the names of, the charge nurse, the nurses who care for the loved one, the CNAs or techs, the unit manager, developing those relationships up front before there's a problem can go a long way. That way, if you do notice something, you've already got a baseline relationship built, and you're not going to introduce yourself at the same time saying, I'm really concerned about this. The relationship is there, and you are, able to go talk to these people, with that baseline in place. I also tell people, take notes, keep up with what is told to you, especially if, they're battling an illness. If you're concerned, for example, urinary tract infections can be, very simple, but can become chronic and can become deadly. Keeping track of, okay, first diagnosed with a urinary tract infection on this day. This is how long they're supposed to take the prescribed antibiotic. Oh, okay. Grandma finished the antibiotic last week, have additional labs been run to make sure that, she's cleared of the bacteria, that she still doesn't have an elevated white blood cell count. This is all medical speak, but sometimes it's just the simple questions just to show that you're involved. You're an active part of the care. You're keeping up with things. And again, they will pay more attention and, more likely to, do the follow-up and escalate issues if this facility staff knows that there's an involved family member there who's really keeping an eye on things.
And I think it's, like you said, I think it's great to show up at all different times. Be unpredictable. Right? Definitely go on the weekends, definitely go late at night, unpredictable, because they don't know when you're showing up. And 9 times out of 10, they're going to be on their toes.
Right. Yeah. Right. And it's not confrontational.
No.
It's absolutely not confrontational. No. It's just establishing a presence there and, being in partnership with the people who you are entrusting to take care of your family members. I mean, it really is a true partnership, and, you holding up your end of things really does make a difference.
Yeah. And it's showing them that you actually care.
Yep.
Yeah.
Absolutely.
Yeah.
Absolutely.
Yeah. These are just I know that as we age, and now there's a population that is such a big population that is going to be facing some healthcare issues and needing to go into rehabilitation facilities and need to be in more skilled nursing facilities. I wonder, again, like I was fortunate that I had the opportunity and the privilege to have my mom live at home with me and be her primary caregiver and have other caregivers in my house. But are we as a country going to be capable of handling all the adults that are going to be needing some skilled nursing care. How do we prepare for that ourselves personally, but also are there going to be enough places for people to be? I mean, how is this going to manifest itself?
Yeah, I mean, it's a big problem when you just look at the demographics in our aging population. It is certainly, we're going to be facing a surge of people who are needing care. I mean, I'm in this generation where I've got aging parents and, still a 95-year-old grandmother who is living, and, I was thinking about her when I said, when you've got grandparents who are sharp as a tack, and if something goes wrong with her memory, it's not due to dementia, it's due to an underlying issue. But, your point is very well taken, because there is going to be a lot of overwhelm in the system. One thing that people need to do up front is make sure that you have a healthcare power of attorney over your family member, so that when decisions need to be made, you have the legal authority to make those decisions, because sometimes things can turn on a dime. Someone can have something catastrophic medically happening to them. And, if you've got that paperwork in place, it just is one less burden and one less thing you have to worry about who's going to be making these decisions. Also, having the conversations with your family members about what their wishes are when they're still able to tell you what they are. You don't want to be guessing, well, would mom want, to be on life support? Would she want a feeding tube? Would she want to pass naturally without any kind of heroic intervention? Does she want to be designated as an organ donor? These are all really important conversations to have when your loved ones are still able to have them, still have that cognitive function, and ability to make decisions and can express those. Even better if it's done legally and in writing. There are, forms that can be filled out by the person in advance, basically giving their advance directives about whether they want heroic measures made, whether that's, a ventilator, whether that's, a feeding tube, lots of things that can be done. But having those difficult decisions now, really can, prevent, some heartache later when you're trying to guess what they would want and you're in the middle of it.
Yeah, that's all great advice, Erin. I mean, it really is so, it means probably more to me because I recently went through this with my mom, but I don't want my children to be, struggling with decisions. So putting it down when we're still in a place where we can, in our mind, body, and spirit, be very together is something that is something very meaningful that I know our listeners and viewers will be learning a lot from this. And that's really the goal of Bench to Bold, is to, if we can't be our bold selves, what do? How do we take care of ourselves? So how did you, we're kind of getting to the finish line of this, but how did you get into this line of law?
It's kind of interesting. I didn't start out, back in my defense attorney days, I didn't start out doing medical malpractice litigation. I had a completely different area of practice, but the first few cases I got involved in, what really attracted me to it is you're always learning something different, whether it's a surgery that you might have never heard of before, or, learning all about wound care because you see a lot of wound issues, or, learning about this particular, medical device that got implanted into someone and then things went wrong. It's just the constant learning and, being, exposed to different things every single day. No 2 days are alike and no 2 cases are alike. And that really attracted me to, medical negligence cases. Is I love learning about different things. And, now that I've switched to this side, I just love people. I love, sometimes talking to them on one of the worst days of their lives when, their parent has just had something catastrophic happen, perhaps has passed away due to the negligence of someone else. And really, being there, being an empathetic listener, listening to them, learning what happened, offering support. I say sometimes, I feel like my role is half counselor, half attorney, but offering them support, and letting them know that they really can make a difference. That's the thing. I saw it on the defense side of things when facilities, hospitals, doctors, nurses, anybody involved in the system, when they are sued in a meritorious legal action for something that went wrong, it really does change things. You know, people all the time say to me, it's not about the money. I just don't want another family to go through this. And I think that's at the heart of so much of this, is improving the system and helping people understand, you know, that they really can improve things. Back when I was on the other side of things, you know, I had a nurse make an error. Like, it was just a flat out mistake, and she injected the wrong medication into a patient, and it caused the patient significant harm. Thankfully, the patient did not die from it, but very well could have. Thankfully, she immediately recognized the error, told her supervisor, and they got the patient the help that the patient needed, and they recovered from it. A claim was brought against her employer for that and for the harm that was caused. And she just told me over and over again, this has changed the way I practice. There were policies in place about these high risk medications, and I just got lackadaisical. You know, it was just kind of a routine thing I did. I didn't double check things. I didn't, you know, follow the policies to a T, because I just got, you know, just another day, another medication, or another patient. And she said, this has fundamentally changed the way that I practice. And I'm going to tell my fellow nurses, don't be complacent. Don't be like me. You don't want to be in this situation where you've caused harm to somebody, and now you're having to deal with attorneys because that patient has filed suit. And so I always tell people, you know, stand up, say something. You know, you might think that you don't have the power to change the system, but you really do, by, you know, raising concerns, and if warranted, you know, seeking legal counsel and filing a lawsuit if need be about harm that has befallen yourself or your loved one. You know, you can do a lot on the front end. You know, you never want to be in that situation where you're having to contact an attorney because something has gone catastrophically wrong, but sometimes you have to. But, you know, doing your research up front, trying to prevent that from ever happening in the first place is really my passion. And educating people, particularly people who are in my generation, your generation, who are having family members go through this and are having for the first time in their lives to, you know, relinquish the care of their loved one to a third party is hard. It's so hard, but there are things you can do, and there are questions you can ask, you know, and things that can be done on the front end to try to not be in the situation.
That's all great advice. Thank you so much, Erin. I feel like I've learned so much. I mean, obviously, these are just major, heavy subjects that we really don't want to necessarily have, but they're so important to have them. So thank you for sharing all of your wisdom and guidance. And, you know, hopefully people won't need to hire you, but if they do, how do they find, if they do need to find, you know, how would people find you if they were looking to find out if they had something that needed legal attention?
Well, I hope none of your listeners ever have the need to hire a medical malpractice attorney, because that means something has gone terribly wrong. But I work at McGowan, Hood, Felder, and Phillips. You know, we practice in South Carolina. We do predominantly medical negligence related lawsuits. So we are always here and one phone call away if anyone ever needs us.
Thank you, Erin. We really appreciate your time today and all your expertise. And, you know, just thank you.
Absolutely. Thanks, ladies.
Yeah. Thank you, Erin. Just the way that you explained it. And I'm sure that you're vicious in the courtroom, but thank you for being so calm and patient and lovely to speak with. So, thank you so much. And for everybody listening, I hope you got some great advice, and remember to, you know, be proactive. If you're not prepared, you're going to be in trouble. So do your homework, like Erin said, and, you know, figure out what makes the best, you know, what best choices are for you. And thank you, everyone, for Bench to Bold. I'm Marnie.
And I'm Elisa. And until next time.
Yeah, thank you.
Thank you.